My name's Elizabeth Peacock Chambers, and I'm a pediatrician at Bay State Medical Center. I'd like to tell you about a qualitative study we conducted to explore the decision-making process of breastfeeding women as they're deciding whether or not to introduce formula or cease breastfeeding. We know that the number of women choosing to breastfeed is increasing in the United States, but the number of women exclusively breastfeeding their infants up to 6 months of age fall well below the goals set by organizations like the American Academy of Pediatrics. Prior studies have helped identify some of the risk factors associated with early breastfeeding cessation, but we wanted to understand the decision-making process that women experience over time, specifically in a low-income, diverse sample of women. We based our exploration of the decision-making process in the theory of planned behavior. The theory of planned behavior is a conceptual framework that describes the association between a person's beliefs, intentions, and behavior. It proposes that a person's behaviors are preceded by intentions, and that both intentions and behaviors are shaped by attitudes or a person's beliefs about the behavior, subjective norms, or other people's beliefs and perceptions of the behavior, and perceived behavioral control over performance of the behavior. We wanted to understand how these factors influence a woman's decision about breastfeeding and how they also change over time. So we conducted a study with 20 breastfeeding women in the Boston area in English and Spanish, and we conducted in-depth, semi-structured interviews at 2 weeks and 6 months postpartum. In the 2-week interview, we asked women about their breastfeeding practices, how they arrived at that decision, and what their plans were for the future. And at 6 months, we followed up with the same women, asked about their practices, and whether or not their plans had changed. We conducted both inductive or data-driven and deductive or theory-driven thematic analysis. Our inductive thematic analysis resulted in a number of different themes associated with maternal decisions around breastfeeding. First was social isolation. Second were the challenges related to returning to work. Third was the ease of accessing formula in the United States. And fourth were perceptions of infant behavior. In addition, almost 2/3 of our sample expressed concerns about perceived insufficient milk supply. And this was frequently cited as the reason for introducing formula or stopping breastfeeding earlier than they had planned. When we mapped these themes against the theory of planned behavior, we found a strong association between perceived insufficient milk supply and perceived behavioral control. Specifically, women articulated a need to gain control over infant behaviors and especially infant crying, as well as a perceived lack of control over their body's production of milk. But our most interesting finding was that these perceptions of control evolved over time. So early in the 2-week interviews, women expressed high levels of distress, need to gain control, and concerns over meeting their infant's demands. Whereas in the 6 months interview, women described their decision-making process and concerns about insufficient milk supply with much less distress. Early on, women used language such as describing their infant as demanding, desperate, starving, or suffering. And later on, they described insufficient milk and demanding infants as part of the normal breastfeeding process and a sign that they were ready to stop. As clinicians, we've made significant progress in promoting exclusive breastfeeding through support-based interventions and counseling. We suggest that clinicians may also want to consider whether they are addressing issues of control, as well as whether they have an understanding of the tension that women feel between their need to control infant behaviors and their perceived lack of control over their bodies. Intervention and counseling may also need to evolve over time with the evolution of the decision-making process. Future studies can help us determine whether incorporation of this understanding into counseling and interventions increases a mother's sense of agency and control, as well as her ability to align her intentions with her ultimate decisions and feeding behaviors.